Okay, continuing in the Envenomation series, we're going to talk now about spider bites. And mainly, we're going to talk about two different kinds of spiders. The black widow, which is known for having an hourglass-shaped red mark on its abdomen, though it can be anything really, like even two red dots. And the other one is the brown recluse, which has this violin-shaped marking on its cephalothorax. So let's name the parts of the body. So this part is the cephalothorax, and then this part here is called the abdomen. Both of these spiders can have deadly bites. The black widow has a neurotoxin, while the brown recluse has a hematotoxin. So let's start with the black widow. So the black widow, also known as Lactrodectus mactans, secretes a venom called alpha-latrotoxin, and it's only the females, so you can see I drew eyelashes on this one, that have long enough fangs to deliver this venom. The males have fangs too, but they're too small. And this alpha-latrotoxin, it's a neurotoxin that works in the synapses and causes all the channels to open, and so all the neurotransmitters are delivered at once, thus depleting the end of the nerve. And so the neurotransmitters that might be released are like acetylcholine, norepinephrine, dopamine. So you can kind of guess what kind of symptoms you're going to see. So at first, with the huge release of acetylcholine, you're going to have a muscle spasm. If a spider bites you on the lower extremity, you might get abdominal muscle spasm, so much so that the belly feels rigid like peritonitis. And if you get bit in the upper extremity, you might have spasms in the face. And then, when all the neurotransmitters get depleted, you're going to have paralysis, which might first start off as ptosis, and that also involves cardiac muscle, so you're going to have cardiac dysfunction. With the initial huge norepinephrine surge, you might have patients presenting with agitation, diaphoresis, restlessness, short of breath, and hypertension. And similarly with dopamine, you're also going to get hypertension with this and tachycardia too. And the symptoms might start in about 2 to 3 hours. They last usually about 24 to 48 hours. They can go as long as 2 to 3 days. So initially, after a bite, after about 10 to 15 minutes, you're going to get some erythema around the bite, as well as some dull, crampy pain. And then this will eventually progress. And we said, right, for leg bites, you're going to get abdominal cramping and spasms that can mimic peritonitis. And for arm bites, you can get facial spasms or a chest pain as well. Now, this can be quite painful. So the treatment for this is to give lots of opiates and benzodiazepines. Now, if that's not working, there is available an antivenin, which is a horse serum-derived antivenom called Lyovac. And the way you prepare this is you take one vial and you put it into 250 cc's of normal saline, and you infuse that over 2 hours. And this antivenom can cause seizure in pregnant ladies, and we're not even sure that it works in kids. Now remember that symptoms can take a while to develop, as much as 2 to 3 hours. So if you think this might be a black widow spider bite, then it's worthwhile observing the patient to see if they start developing symptoms. Now in kids or pregnant ladies, or if you know that this was a black widow spider bite, then you probably should admit them. And admit them to an ICU, because we know that they can get paralyzed and go into respiratory failure from this. Now let's move on to the brown recluse, also known as Loxosceles reclusa. And as the name indicates, that this guy does not like being out and about. He's always hiding under rocks or in closets or in attics, and it's when he's disturbed that he might bite. And the main factor within the brown recluse's toxin is called sphingomyelinase D. And this can have several effects. First, at the area of the bite, it can cause a severe vasoconstriction, leading to dermal necrosis. And it can also cause platelet aggregation, and it may even cause a complement-related hemolysis. Now, much like we did with the snake bites, the rattlesnake bites, there's a grading system for these. 1, 2, 3, and 4. 1 is, of course, no symptoms, no effects. 2 is minor, so some edema and erythema, and that usually just heals with supportive care. Number 3 is dermonecrotic, and that's usually going to heal with a scar. And the final one, number 4, is where the patient is having systemic effects. And these might be generalized symptoms like fever, chills, nausea, vomiting, weakness, and a rash. Hemolysis and DIC, they may also have. Renal failure, rhabdo, and even pulmonary hemorrhage. So you can tell that this can get pretty bad, and it can even be fatal, especially in kids. So the way this presents is that someone might be moving some boxes in their attic, and then they saw a brown spider move away and they get bit, and the initial bite can even be painless. Then after 2 to 8 hours, patients can develop this painful bullseye lesion with the erythematous center where the bite is, surrounded by an ischemic pale indurated area, which is itself surrounded by a cyanotic ring. And then over the course of 5 to 7 days, this can turn into an eschar, which may require skin grafting to fix it. Now, as for the treatment for this, there really is no antivenin for this. Lots of medications have been tried, but it's mostly supportive care. You can consult with a toxicologist regarding treatments such as dapsone and hyperbaric oxygen therapy, but mostly it's just supportive care. And that's the brown recluse. And you get a bonus. The bonus spider is the tarantula. Now, while these guys are ugly and do have venom, the venom is usually used to kill insects, rodents, and even small snakes. They're not really that much danger to humans. They'll only bite when cornered, and they have got nowhere to retreat to, and their bite mostly causes some mild inflammation. Now, what they might do before biting is something called urticating, which is they shoot out these hairs from their abdomen, so they'll turn and face the other way and shoot out the hairs. And if it gets on your arm or other part of your body, and it could cause this papular dermatitis. Now, the problem comes if you inhale these or if it gets in your eye. Then these hairs may require surgery to be removed. And that's it. The take-home point from this is just stay away from spiders and stay away from snakes and bees and wasps.